Yeah.
I'm just going to make sure we don't lose it now.
Yes.
Whoops, where did that go? Oh no, it's back again. Just love IT. It's just terrific. So Adrian's very kindly agreed to chair the meeting today, as Mike's sunning himself in Spain. As all sensible people should be.
Absolutely.
So 1:30.
Yeah, ready to make a start? In which case, welcome everybody. I was going to do introductions, but I think we've already all done that. Know each other now?
I think so.
No members of the public at this stage. And I was also going to welcome Julie, who's not here at the moment, but we will welcome her when she comes, and Samantha and Fiona, obviously, as well. Welcome, your first board meeting.
Hello.
So shall we start? Oh, with apologies. So we've got apologies from Mike, haven't we, and Amanda.
And Karen as well, who's got COVID.
Karen. Yeah, I don't think have we heard from Paul? Or
we haven't heard from Paul, and we're expecting
Martha?
Julie briefly. Oh, Martha, yeah.
Yeah. Oh well, we'll wait. They may join us. They may just be a little bit late. Shall we go on to the minutes? Are we happy with them as an accurate record? Those who are there and have read them. Yeah. And this is going to me. Yeah. Okay. We will agree those as an accurate record. The action log. We've got the contact depression expression. That's on the agenda later, but if there's not much to report on, we might as well cover that now, Andrew.
Sorry.
This I think was raised at the last meeting. One of the members of the public at the last meeting was asking about Kevin Hood about contacts with CAMS, and you said happy to meet with him. So
I've emailed him, and I'm waiting to hear back because I think his input could be really helpful. We've also had offers of input from elsewhere as well, because the challenge is the children, but we'll discuss that later.
Yeah, okay. Thinking Together 6 is on the agenda, so maybe we'll pick that up later.
Yeah.
Healthwatch West Berkshire Testing and Vaccination Confidence Survey. Is there anything we need to discuss on that?
I think we will do that again on the agenda, really. I think it was just one of those things that we were up to that we needed to update on, so we will do.
Yeah, okay. And Voice of Disabilities on the agenda.
Yeah.
Oh, welcome, Julie and Martha.
Hi, everyone.
Well, that's good news.
And the final item on we've made a start. The final item action log is the quality framework. Is there anything to update us on that?
Yeah, so Robert Francis has written to all health watches and moved everything forward. So basically all health watches have got to be signed up to this by the end of the year. I've had discussions with the Healthwatch area rep about this. So really we're in the process of getting it done. We have an advantage that Portsmouth have been through this, so we should have some now natural help from Healthwatch Portsmouth and be able to complete this. But it is something we have to do as part of our Healthwatch license. I mean, fortunately, if you remember the documents I've sent over, it is something we are actually doing anyway in terms of how we process things, but we've just got to formalize it. So I'm talking to Mike about it. So I'm hoping we'll be able to make some progress offline and back online with the board at the next meeting.
Yeah. And the part of that was about the theory of change, wasn't it?
It was.
Which I'm happy to help with.
Oh, brilliant. Thank you, Adrian. Sam, could you just quickly note that?
Okay, so if we move on to Chief Officer's report.
Yeah, there's so much of what I was going to talk about is on the agenda, so I won't overtake time. I think key today really is how welcome it is that we've started to reverse the staffing issues we had at the close of the year with both Michelle and Nathan moving on. So Sammy's been in post since January. Fiona has just joined us and is sharing the role as digital engagement officer with ourselves in Portsmouth, which I think reflects very much the sort of hybrid world we now live in, where geographic location is not necessarily a restriction. And very importantly for us, Fiona knows the locale very, very well. It lives in Speen, so I would very much count as one of our own that we're lending to Portsmouth. So I'm sure she'll be very, very keen to join the team and learn more about what we're up to. I think the other thing I just briefly wanted to talk about, as you know, that the testing project's coming to an end, March 31st, that we've been heavily involved with, and I just wanted to thank everyone who'd volunteered to help out with it. You know, the board have been brilliant, but you know, we've equally had people who've joined in and left and helped out to a tremendous extent. So Julia, Liz, Jackie, Julie Barker, who's working with Anne's advocacy team. We have achieved incredible things in terms of reach, places we've been, number of kits given out, assisted tests done, and it's been held up as a national exemplar of doing engagement work. And I think what's been great for me, and I thought it might happen, is it's actually increased our lines of communication into local communities. So although we came in with one particular idea, it's very much grown from that. And I also want to thank especially Alice and Community United as well, who've been a key part of this. And it just really proves if you get good local people with good connections and you actually listen to people, you get a really good response. The people always know best, they genuinely do, but you've got to ask them questions and listen. So listening's been a really big part of that. So huge thanks to everybody who's taken part in that. And I suppose going on from that, I'm delighted that we are quite heavily involved with both the asylum hotels and hopefully with the Ukrainian program as well, from what we've learned, and work we've done with the Afghan refugee program, because I think we've really added to something. And sometimes it's just that independent piece of scrutiny, and we just encourage people to try and do the very best they can. And we're taking in a survey, not dissimilar to what we did with our homeless rough sleeper survey 4 or 5 years ago, into the hotels to see if we can find out what the key problems are, with a view that, you know, things are made better, that people's rights aren't impacted and people receive the services and care they should, for everyone's benefit. So I'm pleased that we're doing that.
Andrew, that's a home office scheme, is it?
Yeah, it's
being able to do that.
Yeah, we've had to sort of fight our way in, I have to say, because basically the Home Office just books the hotels, sometimes doesn't tell the local council. And this sort of came about from Alice's and Community United's connections. And also we got phoned by the soup kitchen, who'd said they'd had a couple of asylum seekers wander down being hungry and looking for food, which is all meant to be taken care of by the contractor at the hotels. So that sort of spiked our interest. And then with the brilliant assistance of the West Berks Muslim Centre, you know, we actually got to meet some of the residents firsthand to listen to them face to face, some of the challenges and things like that. And West Berkshire should probably pat itself on the back in terms of the community effort has been brilliant in terms of trying to get things improved. Just some really basic things done. The local GPs, I think, have done an excellent job in getting people registered. So, but there's clearly lots of work around this, and this is not something that's going to go away. And just simple things and understanding people's vaccination status, whether people were testing, mental health challenges we've pointed out to, in conjunction with the Refugee Support Service and Community United, we've written to all 3 chief executives of the local councils concerned at mental health effects of basically people being deemed to just sit in their rooms where they can't eat collectively or meet collectively in any space. So we've highlighted that we think that's a problem and a challenge. And as of this morning's meeting, the Home Office are basically confirming that COVID restrictions shouldn't impact on communal spaces, which is the excuse that was being used, it would appear, from the contractor they were hiding behind. Well, because of COVID, we can't open the communal dining room and things like that. So I think lots more to come on that. The other kind of key things I wanted to, we talked about the quality framework and the work we're going to be doing on that. We're also going to be changing our website later in the year with our colleagues in Portsmouth. So there's some work to be done on that. And I'm still in touch with the National Guardian's office about some whistleblower issues in relation to people being made vexatious in perpetuity, which one of our trusts appears to have a rather strange policy. So the National Guardian's office has been involved with that. So I think, Adrian, the other thing just key to note, we haven't received any complaints. We're back in the office on an ad hoc basis, and we've actually met real people face to face, which has been lovely. We do have air purifiers in our office. We have asked Greenham to put CO2 monitors in the meeting rooms, which gives you the reassurance that at least you can meet safely. I think that's all I want to say at this time, because I think the agenda will pick up the rest.
Lovely, thank you.
Thank you.
The next item was community testing project, but that's you've already covered that, I think.
I think so. I think, as I said,
Yes.
The key thing is there's a white paper out today, which is going to detail what will happen in future with LFT testing, because there could be a real problem that, as far as I know, no one knows what's happening in terms of who will be tested, won't be tested, who'll receive tests, etc. And that includes medical staff and social workers, care home workers, things like this. So it's quite an important one, so we will keep our eye on it. Yeah, and there may be something future morphs out of this into a sort of more health inequalities piece of work that I'll update the board about. And Martha's got a hand up.
Martha.
I just wanted to know whether Alice had anything to add, because I know Alice has been seeing all over the place at various venues. She's been to my church. She's been absolutely everywhere, I think. I just wondered whether I know Andrew's just given us a summary, whether she wanted to add anything.
I think most of the stuff that what we do, Martha, we do feedback to a KPI that we have to do. So no, and I think going forward, we will have teams from there. I think that's one of the things that has been very good for us with the engagement bit. And one of the good things about this community testing is how people have become more aware of Healthwatch as well, which has been really, really good for us, because a lot of people, you know, how much we've tried, you know, this has been one place that we've had a massive, massive impact. Because, you know, not only the van, but also the presence of people being there, because, you know, and I do agree with Andrew in the sense that nowhere else has done this. And we have been everywhere, literally pushed, you know, wherever we've been. And we've been also trying to engage with people to talk to them about the services on top of the community testing as well. And, you know, and it has been really, really good. And working with Solutions for Health has been very good as well. And so that has made a big, big, big difference. But yeah, I know Martha's seen me everywhere.
Okay, any other questions or comments? In which case we'll move on to activity and work plan. And the first item there is the testing and COVID survey.
Yeah, so this was something we were asked to do by the clinical commissioning group. they were concerned about vaccine hesitancy, which is now called vaccine confidence, which I must admit I do prefer, because it just turns the thing on its head in terms of saying, well, why are you hesitant, to how confident are you feeling about vaccination, and should be thought of in terms of other vaccination programs as well. So we've been asked to do this by the CCG, and then we've added in a couple of questions about testing, because of course with that coming to an end, we just thought the two were quite linked in terms of what people have been up to and what their thoughts are. So if I can just ask Sammy to give us a quick update, or as far as she knows where we are numbers wise. We've done really well. We've had help from the council. They've put it out on their newsletter. So I think we've achieved a few milestones. Alice has been doing a lot of work on this as well, and with her colleagues at Community United. So Sammy, have you got a number for us?
Yeah, so the latest number up to right now is 538 responses.
And
it's amazing. Thank you, Alice.
Did you not tell me that's the greatest response we've had to any survey so far?
By far.
So, you know, congrats to everyone so far. And we've still got a couple of days. And as I said, I think everyone will find the responses and the details quite interesting in terms of where people's heads are in terms of COVID and COVID testing. So we'll be reporting that to both the ICP, vaccinations board, and presumably the health and wellbeing board and steering groups and things like that, so as they get a feel for what the local population thinks. Right, so that's all I've got to say on that one.
Okay, Thinking Together 6.
Yeah, so this is sort of you and me together, Adrian. We've got we've been talking about putting the next edition of Thinking Together on in the next sort of 3-4 months. But with the work that we've been doing on CAMS and just the general noise around children and young people's mental health, there was some pressure at MAHAG, Mental Health Action Group, to see if we couldn't do something on children and young people rather than just an adults only Thinking Together. So I've been talking to all sorts of people, as has the rest of the team. So we've got some connections with Berkshire Youth, Depression Expression offered to potentially help as well. We have been talking to public health. So our challenge is, though, while we know we can do the parents and carers relatively straightforwardly in terms of how we go about doing this, whether it's a virtual, in-person or hybrid event, the challenges with getting young people and children involved really are sort of stretching our skill set because of consent issues, issues of bullying, anonymity, safeguarding, etc. So that is something I'm progressing with the various local authorities and the education teams. But this is something I wanted the board to have a quick chat about, if possible. Adrian, again, I don't know what your feelings and thoughts are on this as well.
Yeah, I mean, I agree. It's significant issues to get to grips with. I just wonder whether we need to get maybe a small working group together with people on it who have done that kind of work with young people, either engagement work or perhaps more generally, who can give us some substantive support, who know what they're doing, what they're talking about, what the issues are, how to get around them. That could be from more than one organisation. So it could be the local authority and voluntary bodies of different sorts. Time to Talk would be another one, might be worth talking to. And if we get that working group established, that will also give a bit of momentum. You know, they can sort of plan what's happening and get a time scale to it and so on. I don't know what other people think. Oh, Martha, you've got your hand up, and then Leslie.
Yeah, well, I think we talked a little bit about this at the pre-meet, and because Alice is involved in the activity we had at the council to try and engage with young people, and we did our own little sort of survey through schools, and we involved Berkshire Youth for advice, etc. So we did quite a bit of work just trying to find out what their concerns were, and mental health was top of the top of the pile there, and but it was quite difficult to actually, getting the engagement and getting the processes and the follow-up, trying to get in touch with young people in person was quite difficult. So, it's possible, but Berkshire Youth, with their expertise, were very helpful. And obviously, definitely Time to Talk. I think we had a representative from Time to Talk there as well, and we had Alice there. So we had a little group that basically discussed this. So there is a little bit of something there that the town council has done that we could possibly feed into. And one of our councillors is on the board with Time to Talk, as well as she's well retired now, as having been a sort of involved with youth work. So her thoughts might also be possible. So yeah, I think a little working group, which is basically what we had at the town council, probably is what we need.
Yeah, thank you.
Yes, I was wondering to what extent we've had any discussions with CAMS themselves about how they engage specifically, evaluating their services, assessing how they're doing, etc., with their own clients.
Do you want me to come in there, Adrian?
Yes, please. Yeah.
So I've discussed this with Nikki Cartwright, who's the mental health lead, and she's very keen to follow up on this, because the other strand to this, I suppose, Adrian, which links in, is of course the Health and Wellbeing Board have accepted all the recommendations of our CAMS report, so they therefore have to do it.
Yes.
So
quite.
the two things are linked but sort of slightly separate, and I think should probably be brought together. I was at the children's delivery group last week, and we did have this rather odd session, and it was very cathartic, because the CCG presented about how all their CAMS transformation is all going brilliantly well, and the whole thing is RAG rated as green. And as one or two people pointed out, while the process may be green,
Yeah.
the actual service on the ground does not feel green. It feels bright, shiny red with a nuclear warning sign flashing on it, something from The Simpsons.
Mm-hmm.
So the children's delivery group equally are a bit concerned, but the point I did raise, and I raised it as a Health and Wellbeing Board, is stop dumping this only on health. It's not something that can be improved and solved just with health on their own. I think it's going to take the whole system, the voluntary sector, parents, carers, education. And I almost wonder whether, a bit like we did with the homeless problem, where we set up the homeless strategy group, as do they almost need a specific task and finish group, or some sort of body that's going to look at this and help health over the next 18 months? Because as I said, it's very easy to just point fingers and say, well, this is all down to health. Well, they don't have all the answers, and they don't have all the levers. So yeah, and of course, thinking together is part of this, bringing it back to what we were actually talking about, because CAMS is later on. But yeah, I think this is something we should action then, Adrian. I don't know if you agree.
Yeah, definitely. And I like the idea of bringing in the CCG. I like the idea of co-production, which starts with the voluntary sector and then the statutory sector is invited, because it's usually the other way around.
Yeah, I mean, effectively, that's what thinking together always was, which on the adult side, they seem to get. I just don't think it's ever really been done on the children's side. So who knows? Brave new world stuff.
So next steps are that you will get together a group of people who can work on this to progress it.
Yeah, I think we've got to get an action party, task and finish group together to do both, actually, because I think we should still do this sort of two-pronged approach, where we will do one for parents, carers, because they have concerns and worries that should be listened to. And then I think we also do a strand where we're trying to listen to the actual children and young people themselves, even though we're not entirely clear how we can do it. There will be people out there who can help. So that sounds like a good plan.
Good. Do you want to cover CAMS next, since it's linked?
Yeah, well, as we're sort of morphing into it, yeah. So as I said, we have a real advantage and challenge here, that we have to now that the Health and Wellbeing Board has accepted the report and the recommendations, we really need to sort of keep monitoring in terms of, okay, and what? And I'm really pleased we get a really good response from Nikki Cartwright, who's really keen to sort of push this along and work with us. And we've worked really well with the CCG on the testing SMI health checks and things like this, which we did with the CCG, with 8 Bells, and with the GP lead, Heather Howells, who's extraordinary. So I'm wondering again whether do we sort of try and follow that similar model? We find out perhaps who the GP lead is. If it isn't in fact Heather Howells, it may well be. I don't know for children's mental health. I don't know if anyone knows who the GP lead is. I'm not sure I do. I mean, maybe this also reminds me of this sort of exercise. It might be worth us actually writing to the new CCG and saying, who are your responsible medics for various things? Because we always used to know who they were, and I'm not so sure I do anymore, Adrian.
No.
Or even if
They're still in the process of setting that up, are they, as they come into effect from 1st of July?
I would have thought so, but it's a sort of an ongoing thing, isn't it? That, you know, you've got to have normally you'd have a lead GP for most serious conditions or pathways. So I'm pretty sure Heike Veltman's still doing palliative and things like that. I know Heather Howells is doing mental health, but I don't know if it's just adults or if it's across the board. But I think that was a really brilliant model, and you know, I've got to thank 8 Bells for being so inclusive, and also, you know, Joe Reeves and CCG for putting it all together, because we had health checks, vaccinations, and testing all in one place. And having a sort of trusted GP there, I think, was the absolute icing on the cake. So it's a nice model, I think. So I think the CCG thought it was good as well. And thanks to obviously Alice again for helping coordinate all of that. So CAMS, yeah, the CCG seem to like focusing on the service and secondary care. And again, as was pointed out, if we could do more along the prevention and managing lower level conditions, perhaps we wouldn't end up with only ever talking about CAMS. So,
yeah, and that's certainly something that was in the recommendations. It was that we focused on the whole system, not just secondary.
And I wonder, and I also mentioned at the Children's Delivery Group meeting, where were public health?
Quite.
Because there wasn't a public health representative. So if we are doing prevention, and I don't know, I don't know whether this is just because public health has been so poorly funded or supported. It's clear that in lots of areas and pathways, Leslie, they are the missing person. So you have almost you know, the circular debate, and then the key prevention champions either aren't there, aren't invited, or
no, that's a shame. I mean, I certainly think that obviously COVID has been a huge burden for public health over the last couple of years, but hopefully they should be coming out for that now. I have a friend who works in public health in Reading, and she said that most of the COVID work now really is done by the consultants at that level, and that the teams are then getting on with the other public health work. So, you know, we really should be pushing them to get involved with this sort of thing. It's vital. Brilliant. And also it's in the health and wellbeing strategy. You know, it's very large, isn't it? Children's mental health is there. It's a need. So
very much so. Martha.
The Children's Delivery Group you're talking about, that's a subgroup of Health and Wellbeing Board, I assume, is it?
Yes, it is.
Right, okay, because there's so many of them, I'm not even sure I know what they all are. And the public health thing, have they got their funding yet? Because I asked about this at a meeting recently, because I think I read in one of the various magazines that I get to do with counsellors and council work, that their funding is still sort of in the balance, that they haven't got the funding sort of agreed yet. So obviously that affects everything I would imagine, from the number of health visitors they employ.
Absolutely, yeah.
I mean, they should be so important as regards young people, but we really and children. But I think they're really sort of underfunded, and they're not doing the job they used to do at all. And where they pick up should be picking up problems like the hubs barely exist anymore.
Absolutely, yeah.
Anyway, there you go. So I don't know whether they got their funding yet. Was really my point.
Right. Look at that.
So I think we've got some actions there, Adrian. You're on mute. Sorry, Adrian. The words of wisdom are falling foul.
Sorry, I keep putting it on mute because I keep coughing.
Oh dear. Oh, you got COVID? You got COVID?
No, we've been testing. It's just a cold, I think.
Oh, Tony's got it, but he's just like you. He's got a cold.
Sorry. So we've covered contact, depression, and expression, I think, as part of that.
Yes, we did.
Yeah. So on to voice of disability.
Yeah, so I was sort of hoping Paul would be with us, because Paul is obviously a natural person to lead on this. And I said, my slight concern is that this is a big piece of work for Paul, and I think a bit like we were talking about with Thinking Together and CAMS, I think we've probably got to take another look and put some time and effort into supporting Paul. So what I'm tempted to do, Adrian, is we're meant to be taking Voice of Disability back to Health and Wellbeing Board in May with a view to, right, well, here was the report, here were the recommendations, what's happened, and what's been the effect of COVID. I have to say my only concern, though, is I still wonder whether we'll get that done by May. And I don't know whether I go back to the Health and Wellbeing Board and realistically ask them to push it back to September or something. I don't know if anyone's got any thoughts.
It might be better to do a good job, but delay it a bit rather than rush it through, mightn't it?
Yeah, and again, not having Paul available today doesn't really help, because I think Paul's been quite nervous of it sort of landing on his shoulders only.
Is there anybody else on the any other board member who would be interested in supporting him on it?
I think Karen was quite
keen.
writing it, the report, wasn't she?
She was. So I do still wonder whether I hate volunteering people when they're not here,
especially when they're ill.
Especially when they're ill as well. Kicking people when they're down. The other advantage, though, that we may have is now we're back to a sort of staffing complement. Is I know Fiona mentioned to me that she knows Paul as well, so she may be able to offer some words of wisdom as well in terms of how we take that forward. Martha, you got your hand up.
Sorry, I meant to put it down. I'm clicking the wrong buttons here. Sorry.
Oh, okay, marvelous. It's only been 2 years. We should be getting quite good at this.
if there are a couple of people to provide some support to Paul, and he can sort of input the specialist, experience and knowledge, maybe that's the way to take it forward.
I think it is. I think it's just one of these things that, with everything else going on, and perhaps this again, we've discussed this, it's indicative of how disability very easily gets dropped down a list.
Exactly.
If there's sort of more other sort of more high profile areas of concern. So I think I'd quite like the board to be as supportive as possible on that, just generally. Leslie.
I'm not quite sure what we now need to be doing then. I mean, you mentioned going back to the Health and Wellbeing Board and asking them what has happened.
Well, effectively,
but what do we need to do?
Yeah, so if you remember the report, we basically put a stream of recommendations about all sorts of varying services. So I suppose the first thing is to revisit the report, write to the various people and say what's happened.
Okay.
And then I think I wonder whether equally we also then try and follow up with the community to sort of say, are these challenges still challenges?
Right, right.
And just to obviously, top it all off, how's COVID gone for you? And what's that done?
Oh, yeah.
Because again, has anyone asked? Fiona's got a hand up.
Yeah, Fiona.
I think with the Voice of Disability, working with West Berkshire Parent Carer Forum would be a very good start.
Okay.
And Dawn Baxendale is the chair for that. As you say, I know Paul very, very well, so I can liaise with Paul as well. I could help along with that. And I have a son who is disabled. He has autism and mixed type ADHD, so I'm in that area anyway. That's my sort of background. So anything I can do to help regarding that, I'm more than willing to chip in and help along. So
Thank
That's
you.
brilliant. Thank you, Fiona.
I just wonder, something else has just occurred to me, Andrew. I mean, is it worth going back to the board in May anyway, but saying what we're intending to do, that we're intending to write to these people and follow it up, so it kind of keeps the momentum going with the board?
Do you know, I think it possibly might be because, we deliberately asked that they create some sort of disability board to feed into health and well-being, and we were told it wasn't required because it was a golden thread that ran through everything. And I have seen no thread, nothing that looks gold. And since Nick Carter's gone, there's been no noise of any kind about the Disability and External Scrutiny Board. That was the only thing left that even vaguely discussed things, where Nick used to chair it, and basically because of his position, got various providers to come and tell them why they weren't doing something well. I did see Alice with a hand up.
I just wanted to say, maybe going to the board and asking what is the impact of the, what is the recommendations, what have they done, would sort of alert them. Because there are things I know that, like, one of the things that has taken place is they were looking at pavement parking. So I think there are some work that has been done. So maybe, just ask what have they done, and then we also can do the same thing on our side.
Yeah. It kind of keeps the pressure on, doesn't it? Yeah. Fiona.
sorry, do you mind if I just chip in again? Going back to the West Berkshire Parent Carer Forum, they actually are government funded, and they have to report back to the government, where they have a huge national event every year that the ministers go to.
Fiona, they have presented to our board before. Dawn has presented, so we can turn around and work with them again. Yeah, I think.
Yeah, so I think that would be quite helpful to going forward to deal with. Yeah.
Thank you. Have we've got a way forward then on Voice of Disability?
I think so. So I think, Sammy, what we're capturing is that we will take some actions to the May board with a view, though, that we try and find out what from the residents' views are, what else is challenging them, and also ask all the relevant people who are named in the report, what have they done? And actually, I wonder, Adrian, whether that includes Nigel Lynn, he's the new chief executive.
Oh, right.
Because it was Nick Carter who said we don't need to do that because we have this golden thread, and he was running that board. So I wonder whether we've got to write to Nigel Lynn and say, right, Nigel, A, what's happening with the External Disability Scrutiny Board that was in existence, and B, what do you think about this golden thread that doesn't appear to have been maintained? Martha, you've got your hand up.
Well, yeah, I agree with Nigel Lynn, definitely. I was just wondering, because you said, Adrian, Andrew, you're expecting Paul to be here. Has Paul got a problem making the meetings or representing us? Is there some issues? Because obviously
not that I'm aware of. We haven't heard anything, so we were sort of expecting him. So obviously, I'll get Sammy to chase up after the meeting just to drop him a line to say, is he okay? Yeah. So no, so I was expecting him to be here, and obviously for him to sort of be a key part of the discussion.
Yeah, he's not concerned about, I mean, obviously he's put himself forward, so he's not concerned about representing disability at meetings and things like that, is he? It's not something.
I don't get that impression. I think the only thing that was overwhelming him a little bit was just, you know, him imagining it was just all on his shoulders.
Yes.
So I think
if
that
he's got somebody like Fiona supporting him.
Well, if you got Fiona and Karen and then various other members of the board who can just offer an ear or
yes. Yeah.
I think a bit like we said with the Thinking Together working group, perhaps we need a similar working group for VOD, where you know Paul's clearly getting some support.
So he's not on his own.
So he's not on his own. So I he has sort of said he's a bit kind of overwhelmed if he thinks he's going to be doing it all, but that's not certainly my expectation.
Okay.
Okay, thanks. Should we move on to community engagement and West Berks Diversity Forum?
Yeah, and the reason that I've sort of asked Julie to chip in on all of this, and this is because both the Diversity Forum and the Maternity Forum sort of linked a little bit here, and with Julie's expertise, because the Diversity Forum has been very, very busy, but largely focusing on things like COVID. We've still been doing some really good work. And again, with Alice and Community United, you know, there was the fabulous cricket event in the summer, which seems like 1,000,000 years ago, which I know is being repeated. So we've sort of proved the whole concept that we can do some cohesive stuff. We can get together groups of community leaders in the community. So there's been some brilliant work done already, because we've done the food event, we've done the prostate cancer event, we've done the cricket event. And the one thing that was brought to our attention, obviously, Alice, can you remind me which report it was highlighting the difference in outcomes?
Which one are you talking about?
In maternity.
Oh, the Ockenden report that talked about the safety element, and also ethnic minorities. Black women die 4 times in childbirth, and Asian women twice. So
in terms of Diversity Forum, I think we can always find things to meet about. But I think the thing we wanted to discuss today was, did we want it to almost cross over with the Maternity Forum as a piece of work, or should it just always be doing multiple bits? And also, of course, who's going to fund it, because it shouldn't be us running it. So Julie, any thoughts on all of that?
Yeah, I think there's lots of overlap between, you know, the aims, you know, of both, and exactly like Alice mentioned, and what I'm showing even in my research, there's an issue with the disparity between the outcomes according to the ethnicity, but it's also somehow related to socioeconomic context sometimes. So it's not only just a cultural or ethnic issue as well. It's the fact that there is some areas or some communities are more impoverished as well. So even just based on that, no matter where you're from, some of your outcomes are not going to be very good compared to people who are well off. So this is like societal, kind of issue there. But I think one of the aspects which might bring, a diversity forum into a maternity kind of forum is kind of understand different attitudes and a different perspective of people towards their own willingness or their own perception, of antenatal care and the pathway there, how their voices are being heard and their opinions about some things, because we'll bring something into maternity, as it were, no matter where we're from. But there is some concern on the perception from the maternal side, dealing with the actual clinical staff. And I was particularly made aware in my research when it comes to being asked about mental health distress in pregnancy, which tends to not happen when you're a woman of color, for example. So women who are of color, they're less likely to be asked about their well-being, the mental well-being in the antenatal care pathway. And it's a big issue because in some communities, some ethnic communities, it's also a taboo of speaking of mental health issues. So there's an absolute amazing opportunity that
if someone is coming from a place where maybe these things are not discussed, that the door is open at the point of care. The issue that comes again with that is that we have a very highly necessarily coordinated antenatal care pathway, which will only afford 10 minutes, you know, for a woman. And we also have slightly of a disjointed care pathway because there's a lack of continuity of care. So if you come into an appointment and you're meeting a new midwife every time, and you have to kind of reshuffle your life story in a very vulnerable time of your health, and as a person, it just promotes a disengagement in a way. So from a perspective as somebody who's been 3 times through that system, and as an academic, I've worked obviously with communities in London, which obviously are much more diverse than around here. But that's not to say we might not have the exact same issues, just, you know, obviously I suppose targeting fewer people. And I think, having said all of that, I think there's a really great opportunity, the way that Healthwatch and everybody involved has been able to engage with communities due to COVID and the massive engagement that it has received back, that we can just continue, you know, along those bridges and then move that forward into knowing more about how people have perceived the antenatal care pathway, what they would have liked to experience more. We've had some discussions previously during the lockdowns, you know, on maternity care, and that opened very, very interesting discussions. And just hearing the experiences of women and you know, where they're coming from, it's also very enriching anyways. But utilizing, you know, some of the things like the surveys that, you know, apparently people are very keen to respond to and things like that, you know, I'm very happy to be engaged in that, because you know, my experience in research obviously is completely relevant to the outcome measures that you're trying to extract from West Berkshire. So that's what I have to say about that, and I hope to be involved.
Thank you, that's really helpful. Any other comments?
Just me, Adrian.
Yeah.
So I'm almost wondering whether have we got another kind of task and finish group here in the makings, because I'm sure we can put a survey together, but a survey on its own is just not going to get the baby washed, for want of a better simile. We've got what worked with the community testing was being out in the community, being out and talking to people. So I think a combination of obviously online and offline, but actually being with people at the family centres in the right communities is really the best way of doing it. And I wonder again, if, you know, I noted the CQC maternity survey that I sent round again, and maternity nationally still seems to be a programme. And I know we've got the maternity forum as the next item, but I just wonder whether, do we almost have to demand the diversity forum give some attention to maternity issues within the diverse communities as an action, but also then continue the work of maternity forum as we had pre-pandemic, so we don't cross them over? Or do we cross them over? I don't know.
My feeling on that is that they are sufficiently distinct to keep them separate, but it'd be good to encourage them to do a joint piece of work on maternity for ethnic minority.
Yeah, because I think there's a social disparity, so that's not really related to ethnicity or minority communities.
Yes, so
if you have a lower socioeconomic status, no matter where you're born, you know, you can potentially have some impact. So yeah, there's obviously overlap, but there's definitely not to say that we should ignore people who have the majority, you know, ethnic group at all. So I agree with you.
The other issue you raised, Andrew, was about funding. I mean,
yes,
we want to encourage the council to take over the funding of this.
Well, I either that, or I wondered whether, you know, with a little bit of help from either the council, Greenham, or the ICS or a combination of. I'm always slightly depressed that the Better Care Fund, which is a really useful fund of health and council spending, almost entirely focuses itself on only hospital admissions and discharge, which seems a really narrow and limited use, because what's positive about it is that both the local authority and the health have really bought into the idea that we both put some money in and we both try and make sure the outcomes are good. And you think, well, if you applied that principle to things like maternity, surely that would have a positive impact. But I don't know whether we take it to the integration board, or I sort of think we've got to carry it on and then almost look for places and boards of interest. And I must admit, I haven't been too involved. I'm not even clear where maternity sits in the CCG. Has it got its own board? I would, half of me was thinking, planned care, but it isn't planned care. Perhaps it should be, I don't know.
Yeah, maternity is always being, because it's about, you're not sick, are you, when you have
No.
It's a sort of part of life. So it is. And I remember when I did my midwifery, this was always being impressed on this. So it almost is a sort of parallel service, isn't it, really? Yeah.
It sort of reminds you of sort of dental. It's sort of been taken out of holistic health because it's so business
I sort of
as usual.
seem to remember that I used to go to a board, a CCG board, which was kind of like certain things in it. And one of the things was maternity, and one of the things was learning disabilities, and another thing was mental health. They were kind of like lumped in there because they didn't fit into acute or planned care.
Yeah.
They were like, oh, well, we don't know what to do with these other things, so we'll put them in this board together.
So mental health and LD are still together as a board because we go to that. So I know that's the case, but
you never know. Maternity might still be in there.
I don't think it is. But
Oh,
actually, that means
it doesn't make any sense anyway.
I'm worrying where it is.
Yeah, no, I wouldn't know now.
Sort of national outcomes. So I think there's another action point is, shall we find out from the CCG who and where's in charge? Is it just the acutes?
But taking it somewhere like the integration board or health and wellbeing board, somewhere that brings together the different bodies, seems a more positive approach than the CCG.
Because you get, the CCG will respond to the Ockenden report or something like that, but you always get this sort of, well, we're responding. And it's just, but it's not down to just you. Please come talk to, the community you're in theory trying to help. Get them involved. I mean, I don't want to do them a disservice in any way, shape, or form, but I am concerned that this shouldn't be as opaque as it appears. We should know exactly where it is. The results clearly, as we found with our maternity report, are not good. You can't have 25% of the population unhappy. I think there was a dip this year in the CQC report in terms of who felt it was a good service. So it's going in the wrong direction anyway. So it's more sort of alarm bells, really. But the funding one troubles me because I don't really have an answer, because, of course, we always often just race to Greenham. And Greenham have pretty much said they don't want to fund things that they think the statutory bodies should be funding. We have Reading Maternity Voices, but we don't have West Berkshire Maternity Voices.
They're quite good, the Reading one. I follow them. They're really, in terms of, sending out information and things, at least on social media.
I wonder whether, do we need to write to NHS England and say, why hasn't West Berkshire got one?
Why not?
Because it's interesting. We've met with Reading Maternity Voices, who are very good, but they only do Royal Berks.
Yeah.
They don't do Basingstoke, and Great Western presumably has got Swindon Maternity Voices. And Basingstoke will have North Hampshire Maternity Voices. But if you happen to be a woman in West Berks, you haven't got one. Just a thought.
The actions from this then are firstly to find out who is responsible and who's doing what. Secondly, try and encourage some getting together, partly about funding, but partly about taking responsibility for actions. And as parts of those actions, for it to include some work specifically around maternity and ethnic diversity, but recognizing that that's not the only issue, but it is a significant issue.
Sure.
Sorry, I have to go.
Julie, thank you very, very much, because that was the bit I needed you for, really.
Yeah, I was like, I'm gonna get there, but I have to go.
But thank you very, very much, and I think any and all help you can give us on this, I think is because
I mean, sorry to interrupt, but to be honest, I also need to get into the actual clockwork of healthcare, you know, from your side, because it does look like it's a maze slightly, and with all the acronyms, I'm sometimes a bit lost. But as I am here just starting off, I will get used to it. But if there's anything I can do and find out for you, please stay in touch. Sorry to interrupt, but yeah, I'll be very pleased to support what I can. And nice seeing you all. I have to say bye.
Brilliant. Thank you, Julie.
Take care. Take care, everyone. Bye.
Okay, should we move on to volunteer and social media?
So obviously Alice is on leave, even though she appeared to be here before. So we have managed to sort of keep our volunteers tootling along. I think we have a few new ones. Social media, I think is still going in the right direction in terms of followers and people interacting with us. But this, I'm hoping, is where Fiona will come into her own going forward. So Fiona, I don't know if you want to say anything at all. We're not after facts necessarily.
Well, no, I mean, I'm just, as obviously I'm still quite new to the Healthwatch teams, so I will just be looking and just seeing if we can how we can go forward with everything. I think so. Yeah, reach out to more people. I think that's the name of the game, isn't it? So yeah, that's what I will be looking into in great detail.
Thank you. And I think the other key thing is having that attention focus again on reach and impact. So we're not just doing things for the sake of doing them. We actually want them to achieve something.
Thank you. ICS update.
So hopefully Mike, if Mike had been here, he would have told you that there's been quite a lot of meetings with the various Healthwatch chairs from Oxford, Buckingham, Reading, Wokingham, and ourselves, with the ICS head of engagement, Catherine Mountford, and the new to be appointed Javid Khan, who is taking over as chair of the ICS. He's come from Barnardo's, and he seems to be a bit of a Healthwatch fan as a concept. He's come from London and worked very closely with Healthwatch. So I think we appear to have a sort of an approximate ally at the top table, which is good. We're also involved with Healthwatch England, who've allocated some resource to the Bucks, Oxon, Berkshire West ICS, because Healthwatches have to work together with their ICS, and the ICS has to work with their local Healthwatch. We've struggled with this over recent months because of the whole recruitment process where everyone had to reapply for the jobs at the ICS. We lost some of our contacts. We've also now lost the funding on the joint officer. So Catherine Williams finished in December. We couldn't even find anyone at the ICS to continue the conversation with, are you going to continue the post or the funding? So sadly, the very worst of all things is the person with the information has disappeared. So the only thing we know is that we have to come up with a method of agreement across the 5 Healthwatches, and there's some work ongoing on doing that. We're waiting back from the ICS in terms of what they want us to do and inviting us to it. I think on a positive note, we've had some more senior level inquiries from the CCG, so that both the COVID survey, there's another piece of work they've asked us to look at about, funnily enough, children's mental health that we haven't had time to respond to. And we've also worked on the Crisis Cafe rollout in West Berkshire as part of the Mental Health Action Group. So some things are improving, some things don't appear to be improving, and some things we actually have no idea what they're doing. I just wanted to update everyone though on something that is pertinent, which is the advocacy piece. I've won the contract for Healthwatch Wokingham. So that effectively means that we will have probably more one combined voice from an ICS perspective. Jim Stockley, who is the chair of Wokingham, was going to stand down, but is going to stay on temporarily. He knows Mike very well. But the challenge seems to be how 3 unitaries the size of Reading, Wokingham and West Berks can get heard over a huge locality like Oxfordshire or Buckinghamshire, which has always been our concern, that it doesn't seem, and Berkshire West kind of gets 1 vote rather than 3, so we almost appear to be a sort of a 5th of the ICS rather than a 3rd or equal partner. So that's a concern. So there's lots up in the air, and I genuinely think Healthwatch, both Healthwatch England and NHS England, all these plans are coalescing. I just still don't see a path through. We sent through the engagement. They have to come up with an engagement strategy. We are mentioned 23 times in that single report, which is good. And they do now at least appear to have realised that we are not the VCSE. We stand on our own statutory note. So yeah, so clear as mud, it would appear. The other thing, I did see a briefing about the 20+5 initiative, where they're going to choose the 20% of the population with the worst outcomes, and then ally those the 5 key conditions as part of the 20%. And I was told that most of the funding for that would be going into Oxfordshire and Reading. Unsurprisingly, because of course, again, numbers. And this was this aggregation fear that if you're going to do health inequalities, well, it'll all go to the place that's got the most of it. So I think, you know, it's down to our local authority and ourselves, and the same with Wokingham, to fight our corner to say, you know, while things are very good, generally speaking, in West Berkshire and areas like that, we still have our areas of challenge that shouldn't be ignored. So yes, so the ICS comes into being on the 1st of July. I don't think there's anything else. Has anyone got any questions? Leslie?
Just in terms of CCGs, then, so CCGs don't exist now, or they won't exist from the 1st of July.
Yeah, so all the policies CCGs being written out of existence, and the funding will go into the Bob ICS and then cascade down to place, which they keep telling us is really, really important. And we appear to have a space on what's called the the ICP board. It's the place board we've got a seat on, but we haven't got a seat on the actual ICS main board.
Okay. Thank you.
It's good though that they've recognised the you know what the key problems are in the health service, that it actually needed a top-down reorganisation. That was really what was missing.
They hadn't had one for 5 minutes.
Yeah. Okay, ICS, anything on work plan?
Sorry. I really just wanted people to start thinking forward as we come out of both the COVID stuff. We've obviously identified VOD, CAMS, maternity and things like that. Is where we should be looking for 2023 and beyond in terms of areas of work for us to look at.
Mm.
Is this something that we could take up through the quality work? Because I mean, that's about standing back, isn't it? And looking at where you're going and how you can achieve things.
I think that's a very good suggestion, Adrian.
Martha,
So what are you saying, Adrian? The equality work? Which
no, sorry, quality work. There's
quality.
Quality.
Sorry.
no quality rather than equality.
Okay.
A framework for looking at what you're achieving that Healthwatch England are asking the Healthwatches to go through.
Well, yes, we're all working together. I mean, we have been talking about the first 1,001 days, you know, and that's still an issue where, I mean, everything that's happening is going to be affecting children more than anything. The shortage of food, the shortage of heat, the pressure on families, you know, the shortage of services, pressure on public health, you know, I mean, and children are just going to miss out and nobody speaks up for them, you know?
No. In terms of setting up of working groups, how are you going to do that then? Do you want people to volunteer, for, you know, members of the board to volunteer to be part of specific working groups, or what do you want to happen?
I think it's twofold. I think what I'm hoping for is we can do some work on our volunteer cohort and increase that, and then potentially get board members to not lead necessarily, but organise and utilise the people that are out there. Because I think one of the things that should come out of all the stuff we've discussed is that Healthwatch is a really important and useful medium for getting challenges in health and social care across. So if you want to do something, which the public seem very keen to do in health and social care, well, why not join us? And then if you've got a particular area you're interested in, so whether it's the 1,001 days or maternity or CAMS or disability, come join us and do some work here, because at least you know that the work you do will end up being discussed in committees and boards that change things, decide things. Adrian, I also wondered what your view would be on, when we're looking at work plans, this alignment with things like the 10-year strategy, because there's so much work being done on it and the public have said that's what they want. I'm almost thinking, do we take that as a red, as a sort of almost a direction for Healthwatch work? And then do we also then add in the feedback we're receiving, which might come from, say, dental, and then the other obvious local issues would be that, hospices, continuing healthcare, the health inequalities. What do you think?
I think it's certainly important to take account of the 10-year plan and other strategies and policies, so that you're working with the agendas of the bodies, because then they will take notice of what you're talking about, but not to try and reproduce what's happening anyway, but to sort of, I think, as you were saying, really, find the gaps and where we can add something distinct.
I think the other interesting conversation I had, and I can't remember where it was, I think it was probably primary commissioning, was that the whole pressure on primary care is such that it's now really genuinely not coping.
Yeah.
And you can't magically go and recruit 5,000 GPs out of nowhere.
Yeah.
But one of the things they have tried to do is, obviously, the new personnel coming into primary care under the ARRS and social prescribing and pharmacists going into GPs. But one of the things I keep pointing out is they keep putting these roles in, but they don't necessarily tell the public what they are, what they're there for, what they're meant to do. And every other campaign says, go and see your GP.
Mm.
And then they're surprised when people get frustrated that I can't get to see my GP.
Mm.
And I wonder whether there's something in this in terms of an explanation, piece of work, or
maybe sort of getting people to trust the services, that they're not just being fobbed off with something the second.
Well, I actually think what they're missing is they're not explaining what they're doing.
Mm.
They're just changing them, and then the names on the doors are different, and you think you're trying to do this, and actually you should be doing it something else, but they just don't explain it.
do we bring something like that to Health and Wellbeing Board to help them to sort of push that something along? Because we have all the different.
I mean, we can bring it to Health and Wellbeing Board, but again, in terms of actually telling the public, bringing it to Health and Wellbeing Board doesn't get it out to the public.
No, but that as a as a thing, they should, or they should, they're not, but they should be able to sort of think of ways of communicating things,
So that's something else I just wondered, with all these transformational changes, the last people they ever tell are the public.
Yeah. I mean, you wouldn't know the Health and Wellbeing Board was a public meeting because nobody ever attends, really, and that's it's a chance to know what's going on about their health and well-being. But I think that's what the Health and Wellbeing Board is supposed to be about: getting everybody together. What's not working? How can we, as a council, help to sort of get stuff out there and move things along? It just doesn't seem to work that way.
So how are we going to take this forward on the work plan? I think it needs this sort of standing back and looking what we can achieve, how we need to fit in with other agendas and so on. Would it work as part of that quality? Because part of that work,
I think that's an excellent suggestion, because I get the impression, Adrian, we're busy enough.
Yeah.
Until probably September, if we did nothing else. We've got enough on our plate. But we still have to start working on this quality framework because we have to get it done by the end of the year. So it almost feels like that can run in parallel. And perhaps that's a really good suggestion. Actually, we make the work plan dependent on the quality framework, or at least talk to it. So we come back sort of November, December time with the work done on the quality framework, and because of that, potentially the work done on the work plan, because we've got to have some idea by September of what we're going to be doing in 2023, or at least the topics we're thinking about, or whether we're extending some of the things we've discussed. So I think that sounds like actually linking the two things up is a very sensible thing to do. And I think I can probably check with Siobhan in Portsmouth how they play it in terms of their QF work and their work plan work. So that's where we should have some advantage, and potentially the same with colleagues in Woking. Okay, that's the way forward on that then. Questions from public and audience? From the public? None. Any other business? Amanda sent round an email late this morning about ambulance waiting times. This chap, this boy who was playing rugby and had to wait 2 hours for an ambulance. Is it something we can get with in any way, monitor, raise our voices? I think it's really odd, because I got the papers for urgent care. I'm not sure if I got them by accident or not. And then I thought they wanted me to join, and they said, oh no, we can only have one Healthwatch representative, which happened to be Reading. So I think this is the challenges of the new ICS. These are sort of one of the things. This is why not having a joint officer is a miss, because they're sort of saying, well, having Healthwatch Reading there is the Healthwatch representatives. Like, well, it clearly isn't, because the challenges of getting an ambulance in Reading are pretty different to the challenges of getting an ambulance out in Kimpbury or somewhere like that. So we haven't, I think probably until the last 2 years, we haven't really seen too many challenges or issues with ambulances that we were aware of. There's the odd bit of patient transport stuff. So I don't know whether we keep a watching brief on it, or whether we raise it with the commissioner about this particular incident and see if...
I wonder whether it's more, as you say, keeping a watching brief and looking at the stats. Are they sort of going in the wrong direction, rather than picking up on one particular incident?
It wasn't just one incident. If you read the little thread, it was like a sort of Facebook thing, I think, and all the comments were saying they had experience of similar incidents. So it was one incident, which with lots of comments saying, and yes, this happened to me, and yes, it was 4 hours, and I was told 3 hours. So everybody that responded seemed to be having quite similar.
Could I make a suggestion and that we send that on to Fiona to have a look at the Facebook thread to see whether or not it's worth highlighting that folk get in touch with us as a body, or link up and see whether or not it runs any deeper.
I mean, since COVID, ambulance waiting times have been getting really, really problematic nationally, and the worst ambulance trust is our own. South Central
Really?
Ambulance has the worst figures in the country. So, you know, it's not as if this is a new problem. This is an ongoing problem, and it's a big one. So
Yeah.
I'm not quite sure what we can do about it, but it's definitely an issue.
I mean, it might be one that we could raise across the whole Bob footwork, because of course SCAS is one of the few services that runs
Goes right
from
across.
Milton Keynes down to Southampton.
Massive, isn't it?
You know, it's now huge. So
Yeah.
perhaps that's where that sort of pan Healthwatch thing might actually work out, and we actually invite SCAS to come and talk to all the Healthwatches.
There's probably, as you say, Leslie, there's probably not much we can actually do, but we ought to at least raise our voice and say,
Yes.
Okay, any other business?
I think so.
No. Have we got a date for the next meeting? We'll do that by email afterwards.
I think so. And can I just thank everyone for getting through the agenda so that we can get folk off to the Ukrainian meeting. We were a bit unlucky with scheduling on this one, with various people being away and what have you. So I really appreciate everyone finding the time to come. Sammy, can we just drop Paul a quick email?
Already done.
Okay, just to check he's okay and what have you. And thanks very much, everyone. A brave new world beckons in terms of ICS is starting in July the 1st. We're taking over Healthwatch Wokingham as of April the 1st.
Wow.
And then the other, and then also, funnily enough, Southend. But I've only really had any involvement with Wokingham, which I think becomes useful. So if anyone knows anyone in Wokingham as contacts who may or may not be useful, volunteer-wise, just knowledge-wise, do chuck them our way, because we want to make sure we're a bit like we are in West Berkshire, where we've got that network of contacts of people who know their stuff. So all suggestions are welcome, really. And again, thank you very much for your time.
Yeah, thank you very much, everybody.
Okay, thank you.
Thank you. Thanks very much. Thanks for sharing, Adrian.
Thank you, Adrian. That's very kind.
No problem.
Bye.
Take care.
Thank you. Bye-bye. Bye-bye.